Well, good morning, everyone, and thank you for joining us today as another part of our ongoing teletown hall discussions around COVID-19. Just to remind you the format, you will have an opportunity to ask questions. You'll see the question box on the far right of your screen so that you can enter them. I'll be having a conversation with our guest speaker for a while, and then I'll be turning it over to my colleague, Matt Patton, who will be delivering your questions that you submit. I do always like to say up front, sometimes it's hard to get all those questions in, so we'll do our best, but please just be patient with us if we don't get them all in. And I have a feeling anyway, based on the conversation that Dr. Khaldun and I are going to have, you'll probably get some answers right from that. So Dr. Khaldun, welcome. Dr. Joneigh Khaldun, who's the Chief Medical Executive and Chief Deputy Director for Health, Michigan Department of Health and Human Services. Dr. Khaldun, thank you for coming back to join us today.
Thank you for having me back.
Absolutely. I want to first check and see how you and your family doing. Everyone's staying well and staying safe?
Oh, thank you for asking. Yes, we've been very blessed. We're all healthy and kind of hanging in there, just like a lot of other folks. So thank you for asking. I hope you're doing well also.
We are. Thank you very much for asking too. So we're going to spend most of our time talking about the state's vaccine rollout. But before we do, I'd like to provide you an opportunity to give us a quick update on what the state's COVID-19 metrics are. Any concerns you currently have or points of cautious optimism to share with our audience?
Absolutely. You know, I'm very optimistic. We've seen our fall surge come down significantly. We're seeing our case numbers, our percent of tests that are positive, and the percent of inpatient beds that are being used to take care of COVID-19 patients. Those are all coming down. We're not quite where we were at our lower point over the summer, but we are pleased with what we are seeing. I call it cautious optimism. One thing I am concerned about, though, is that we're seeing more and more cases of this more easily transmitted variant of the virus, B.1.1.7. We've seen outbreaks across the state with this virus, and so it's really important that we continue to be cautious as we move forward with fighting this pandemic.
Right, and all the more reason for us to be very cautious and making sure that we're talking to our colleagues, our employees, and everyone about the importance of the vaccine. So given you do still work as an emergency doctor at Henry Ford Health System in downtown Detroit, how would you describe what you're seeing today versus back around the holidays? And what do you think the biggest changes have been in the past month?
Yeah, you know, I can speak, of course, anecdotally to what I see when I work my couple of shifts per month. And let me also start by saying I'm incredibly proud of the healthcare workers, and not just doctors, but nurses, frontline clerical staff, our environmental services staff. They've been doing this for a year now and have been putting their own lives at risk, quite frankly, to protect others. So I'm incredibly proud of our healthcare system leaders and our frontline healthcare workers. I'll say we're still seeing patients with COVID-19 coming into the emergency department. I see one again. I only work a couple of shifts a month, but I still see patients, and some of them are quite ill when they do come in. So I think it's important that we understand that this virus is still very present across the state. Even though our cases are coming down, we're still seeing many cases and deaths across the state. So we have to continue to be cautious. And of course, when the vaccine becomes available to you, please do get it.
Right. So there's currently 2 vaccines available, one from Pfizer and then also the Moderna option, which kind of came on quickly. Did it surprise you to see both become available so quickly?
You know, I was a little surprised, pleasantly surprised, that we were able to make these vaccines available at the end of last year. I'll tell you though, these vaccines, they're messenger RNA vaccines. So what does that mean? It basically gives your body a blueprint so that the body can start making antibodies against the real virus in case it ever comes in contact with it. That technology is actually not new. And that's the reason why we were able to move forward with these vaccines becoming available in December.
So how do you counsel people, or how do we continue to make people aware that we're concerned about the speed in which they were developed and whether they're safe?
You know, these vaccines are safe and effective. That's very clear from the data. Even as we've rolled out, there have been millions of people who have already been vaccinated across the country. And we know from the CDC, who looks at all the data from people who have been vaccinated, if there's any potential adverse effects from the vaccine, those are reported back to the CDC. And the data still shows that these vaccines are safe and effective. And so that's really, really important. There were no steps that were skipped in the vaccine approval process. So really, it's a good idea for people to get the vaccine when it becomes available to them.
Right, and of course now we know that Johnson & Johnson is likely to be the next vaccine that's going to be available. Can you speculate on how many more additional vaccines may still come to market?
You know, I'm very excited about the potential for an additional vaccine to come and be available. Again, the more vaccines we can get, the quicker we can get out of this pandemic. I do not at this point know how much vaccine would be available to the state of Michigan if this Johnson & Johnson vaccine does become authorized for use. So we continue to be in contact with the federal government on a weekly basis. And again, as soon as I know, other people will know as well.
That's good. We'll hold you to that. We might have to bring you back again. So maybe this is an unfair question. It might not be something you have right on the top of your head, but do you know how many people in Michigan so far has received the vaccine?
I do actually. So over 1.7 million doses of the vaccine have gotten into arms across the entire state since we began our vaccination efforts in December. So that's a lot of progress. 15% actually of Michiganders who are eligible have now gotten at least one dose of the vaccine. And over a quarter, over 25% of people over the age of 65 have been vaccinated as well. So we're making great progress.
Yeah, that's good progress. Still a long way to go, I'm sure, but we're working at it and we'll finally get there. So let's talk about some of the challenges with the vaccine rollout, or the reporting that says there's challenges with the vaccine rollout and the ongoing administration of doses. What is the primary hurdle, Dr. Khaldun? Is it vaccine supply, capacity to administer shots, scheduling? Can you help our audience understand that?
Yeah, I'd say the most important thing that we're missing, excuse me, is the supply. If I had enough supply, you'd be able to show up any pharmacy, your doctor's office, just like you would the flu shot, and be able to get it without even scheduling an appointment. But unfortunately, because we do have such limited supply, we have to be very strategic with how the vaccine is rolling out. I will say every dose that is distributed across the state, it's either in an arm or it's scheduled to be in an arm. So I think that's really, really important. People often look at this difference between what's distributed and what's gotten into an arm. That number is not going to be zero. It's not that the vaccines arrive, they're shipped in a box, and then automatically within 2 hours they get into everyone's arm. There's a scheduling process. There's a how you handle the vaccine. It has to be thawed. So I think people have to have a understanding of the operations of it. But I'm quite pleased with where we are in the state.
Okay. How are the vaccines currently being prioritized, and what group is next?
So we are following ACIP CDC guidance when it comes to how we are prioritizing groups. Right now, people over the age of 65 are eligible to be vaccinated. We do have a special program for areas that are able to really target folks and remove barriers to access, whether that be because of transportation or housing or language status. We are allowing folks to apply for vaccine for 60 and up. And then, of course, we have our frontline workers. So, of course, our frontline healthcare workers were eligible in the very beginning, but now we have K through 12 teachers, we have police, firefighters, people who work in congregate settings as well who are eligible to be vaccinated. Again, as we get more vaccine into the state, we'll be looking to expand that eligibility group as much as we can. Again, we have to be incremental. We'll be incremental when it comes to age and also looking at those essential workers.
Right. So when you talk about phasing it in, healthy individuals under the age of 50? When might they be able to get a spot in line? And I'm guessing that when I ask that, that's really saying getting to general population, right?
Absolutely, and that all depends on our vaccine supply. I am not holding back any doses. There's no warehouse in Lansing where we're keeping doses. That all depends on, like we talked about earlier, the Johnson & Johnson vaccine, the supply at the federal level, how much they're going to be able to give us as a state. And as we get more, we'll be able to expand eligibility, again, as quickly as we can. I will say, I understand that it is frustrating. There are more people eligible today to be able to get a vaccine than we actually have supply. And I understand that's frustrating because people are trying to get an appointment and they may not. So we have to be very mindful of that as we open up eligibility to make sure we don't let the demand go too far ahead of the supply, although we recognize that that is what we are going to have happen throughout this process.
Sure. So for our listeners who are with us today, wondering when it will be their turn, and you've just pretty much helped with at least a guesstimate of that timing, what is your counsel on how they will know when they can, and then what do they need to do to get in line?
Right. So we do have, of course, we do press releases at the department in DHHS when we do announce newly eligible groups. We also have a website where you can look at where the local health departments are where you live and if they may be able to have an appointment for you. You can also call 211 to be able to get help when it comes to scheduling an appointment. But by and large, we are being very public when we do move forward with different eligibility groups. If you get your care at a federally qualified health center, they may be reaching out to you. And we also have several pharmacies across the state that have vaccine as well.
So most of the people listening today are from our business community. Will employers be able to offer vaccination to employees, or will it be exclusively via public health hospitals, CVS, Walgreens, et cetera?
So right now, it will likely be working very closely with your local health department or your healthcare system. We know there are some very large businesses, obviously, that have occupational health programs and whatnot. So it would make sense eventually for people to be able to get vaccinated, to be honest with you, like our healthcare workers have through their employee health systems. But right now, it's working very closely with your local health department. And as we get more vaccine, those local health departments will be working with these essential employers to be able to get their teams vaccinated.
I know for many employers, many of the drugstores will come in and do and administer flu shots on an annual basis. So I was wondering if that might possibly become an option for some of our employers. So I guess we'll have to wait and hear from the drugstores on that.
And I'll be honest with you, again, I long for the day when you can go to your primary care doctor, you can go to the pharmacist, you can go to your employee health and just get your vaccine. Unfortunately, again, because we're so limited with our supply, we're not able to do that right now, but I'm hoping that we will eventually get there.
So the chamber actually did a statewide poll of Michigan voters in November. And at that time, 57.8% of white voters indicated that the Black voters said the same. What is currently being done or trust among Black Michiganders and the safety and efficacy of the vaccine?
Yeah, I think that's a really important point. One thing we know is, there are Black and brown communities that do have some skepticism when it comes to not just vaccines, but the healthcare system in general. And there's a reason for that. There's been clear, documented mistreatment of Black and brown communities by the healthcare system that's been intentional often. And there's still bias that exists in the healthcare system. So I think that's partly why a lot of people are still hesitant to get the vaccines. We are aware of this at the state. We do have a robust media and communications effort. We're engaging the faith-based community and fraternities, sororities, other organizations that are really embedded in the community so that people can get access to the information they need from trusted sources. I'll also say a really important point about this is access. not everyone is able to get to a mass vaccination site, or maybe they trust their pastor or their faith leader more than they do even me, and that's okay. I don't take offense to that. So it's really, really important, and that's what we're emphasizing at MDHHS, is that people get into communities and bring the vaccine into the communities where people are, and that's how we'll be able to eliminate barriers to access, and also get people more willing to take the vaccine because they're working with their trusted community leaders.
Sure, sure. So aligned with that, let's talk a little about racial disparities in COVID-19. You've been a leading voice on this throughout COVID-19 and the disproportionate impact on Black Americans and those in other underserved racial and ethnic communities. Can you talk to us about the inequities that have been uncovered, and how can we all help in any way?
Absolutely. You know, I don't think it's a surprise that we've seen inequities and disparities when it comes to COVID-19 cases and deaths. I'll say it again in the beginning. We know that African Americans make up about 14% of Michigan's population. They were 32% of cases and 40% of deaths. And we were able to, by being very intentional and strategic, essentially eliminate that Black-white disparity when it comes to cases and deaths. And we did that by making sure, again, going to the community, engaging with the community, making sure they had the information they needed about masks and how to safely quarantine and isolate. We made more than 6 million free masks available to communities across the state. And we made testing accessible, bringing testing into neighborhoods. So these are really things that are bread and butter public health, messaging and bringing resources into communities so that they can be safe. And that's what we are really striving to do with our vaccination efforts as well.
Yeah, we find as a chamber, we like relying on the neighborhood organizations to be able to feed us information on what's happening in those particular neighborhoods, and especially, you know, as it relates to smaller businesses. We really appreciate their help. So earlier this month, you were named to President Biden's COVID-19 Equity Task Force. Congratulations on that.
Thank you.
Can you share with us what this work will entail?
Yeah, first of all, let me say I'm incredibly honored to be nominated for President Biden's Health Equity Task Force. It's something that's really important, obviously, has been front and center to the work that we've done in the state when it comes to COVID-19. And I look forward to working with my esteemed colleagues from across the country to really help to advise on how to address these disparities and inequities that we just spoke about, how we can bring resources into communities, how we can move forward with a vaccination effort that really prioritizes equity as a value as well, not just in Michigan, but across the entire country. So I really look forward to working with the task force.
If let's just say for today anyway, because I'm sure it'll just keep getting better, but if you had to give Michigan a grade today in vaccine rollout, what would it be and why? And is there other areas of the state that you think would get a higher grade?
That's an excellent question. You know, I'm going to defer. I'm not going to grade anyone, but I do think that everyone, whether it's local health, especially our local health department leaders and our healthcare systems as well, they've done a really great job with building out the most massive vaccination effort that in modern history, potentially ever. With little information, we haven't known in the beginning. We didn't know how much vaccine we would be getting. We still don't really know how much vaccine we'll be getting. With the challenging logistics as far as especially this Pfizer ultra cold vaccine, I think everyone's really been doing a great job. Everyone's doing their part to try to end this pandemic, and I've been very proud to be a Michigander.
Well, I know there was great national news about where Michigan was ranking on the list of how the states were performing. So congratulations on that also.
Thank you.
I am now going to turn it over to my colleague, Matt Patton, who is watching your questions that are coming in. Hi, Matt.
Hi, Tammy. Thank you. And thank you, Dr. Khaldun, for joining us again today. I know your time is extremely valuable, to say the least. Thank you for all the work that you do on the front lines, for now a year looking at this pandemic. Got some really smart questions from our audience. The first one asks about the variant or the multiple variants as it pertains to the vaccine and its efficacy. Can you talk a little bit on that and is there anything people need to do differently to stay away from this variant? And once they're vaccinated, what does that mean in terms of coming in contact with variants, should they?
Yeah, I'll tell you, I am concerned about the variants that we're seeing across the world. It's important to know that this is what viruses do. When they spread from person to person, they kind of change and mess up, if you will, their DNA, and then they make mistakes in their DNA. But sometimes those mistakes in their replication process mean that they're more easily spread, or that they can evade our best defenses, whether it's our antibodies that we're using now to treat people or vaccines. The good news is that for the B117 variant that we've identified thus far in Michigan, it looks like the vaccines that we currently have are actually do work against that B117 variant. So that's good. The most important thing that everyone can do right now is get their vaccine when it becomes available to them, and to continue wearing their mask, washing their hands, and social distancing. And we can prevent the spread of the virus, whether it's the variant or the other virus that we've seen over the past year, the normal virus. We will be able to really effectively slow down the spread of the virus. So that's the most important thing people can do, is really all of the bread and butter public health things we've been talking about over the past year.
Sure. What about that though? If there's folks on the line listening, they're still considering whether or not they want to get the vaccine. I know I've had discussions with family who are still struggling with that decision. What can people know about how their decision to get vaccinated might be linked in a very real way to the duration of the pandemic?
Absolutely. These vaccines are 95% effective in preventing symptoms from COVID-19. They're keeping people out of the hospital. They're keeping people from dying. And again, I don't know if I need to say it, but we have had an incredible amount of death from this terrible virus over the past year. And it's also important to note, many people who get this virus, they may not even have to be hospitalized, and they make it through. This is not like a cold or the flu. People are still having longer term health consequences that we are still learning about. People who can't walk up the steps anymore, and they were young and healthy before they had COVID-19. People who are having problems with an enlarged heart or kidney challenges. These are things that are, quite frankly, a little scary. And so I think it's important that people know getting this vaccine is important for your own health. But you also don't know, even if you make it through this virus, you could still spread it to other people that won't be as lucky. And so I think people really need to understand we're all in this together. And if you get your vaccine and you wear your mask, we can get back to a sense of normalcy more quickly.
Sure. So a lot of folks have concerns too. We mentioned a bit about information folks have to sign up for the vaccine, the priority groups, and the access to. What can you say to folks that might not have ways to sign up for the vaccine? If I'm someone who comes from an underserved population, or a senior who doesn't go on the internet, doesn't read releases, might not know what 211 is, how do they sign up if they're willing folks to get the vaccine? What should they do?
Absolutely. So we do have a robust media campaign. We're TV, newspapers, we're doing interviews. We're also engaging with community-based organizations, whether it be faith-based organizations or others, our senior centers. We are really engaging with communities across the state to make sure they have the information that they can give to people. So that's really, really important. I think there's always more work to do. I want to reach everybody. Absolutely want to reach everybody. I want to even, we're working on a program to actually bring vaccines to people in their homes. So homebound strategies that I actually know some local health departments across the state are already implementing. And again, we do have 211. We do recognize that a lot of people don't have a computer or the internet, and so you can call 211. We have a partnership with them to help people learn about where they can get a vaccine if one's available for them.
Thank you. Getting some questions too, folks wondering about priority designations for folks with disabilities. I'm also heard too that I think soon Illinois is going to be extending the risk group of that women who are pregnant. Is that something that Michigan is looking at, and how should we expect our priority groups to stay the same or evolve as the vaccination process forward?
Absolutely. I mean, I'll tell you, it will, just like everything with COVID-19, it will continue to evolve. We continue to learn more. And as we get more vaccines, I'm hoping to make it more simple and get more and more people vaccinated more quickly. So that's really, really important. We also really are in our strategy that we've also put, talking about and putting it online. We don't want anyone, whether it's disability status, language, whether you're a racial or ethnic minority, whether you're a part of a tribe, we don't want anyone to have unnecessary, and none of them are necessary, but we don't want anyone to have any barriers to access. So that's why we're really asking our partners and our local health departments, you have to engage with folks who are in the neighborhoods. You have to engage with these community-based organizations to be able to remove those barriers to access.
Looking at a final question, a pointed question, I think it talks to both data and the supply chain with the vaccine. We've seen the news recently that struggles with availability of syringes needed for, I think, the Pfizer vaccine, and also folks looking that they're concerned about reporting times for vaccines being shipped and the doses administered. Do we expect any increased transparency, or where should folks look to see how many doses have been administered?
Yeah, we do have our dashboard that we update Monday through Friday that tells us every provider who gets vaccine, they are actually mandated to put that information into our system within 24 hours of that vaccine being administered. And so we use that data to actually update our dashboard, which again is updated Monday through Friday. And that's where you can go and see, even by dose, by location, by age, by Pfizer or Moderna, you can see all of that information on our dashboard on a daily basis.
Seeing that dashboard, and just one to wrap up, is there one place that exists where folks that are interested in getting the vaccine, I know you can sign up now with pharmacies, you can sign up with your health departments, a lot of different ways. Often the information, my mom thankfully is scheduled to get her vaccine here in a couple of weeks. She had it rescheduled, and she found that information out through a cousin who heard from a friend or somebody and happened to know that you could sign up, and that one Rite Aid on the east side happened to have vaccines available. Is there a talk, or is there something that the state is looking at? If I'm interested to get a vaccine, that I can go to this one place and I can find or put my name in the system where I can be signed up for the vaccine, instead of hearing about, or managing signing up at all the separate pharmacies and health systems and health departments?
Right. So I think one thing that everyone has learned from this pandemic is that our data and technology systems in public health are not as interoperable or easy to work with as many people, including myself, wish. I do wish there was just one place where you could just go push two buttons and just automatically be signed up for an appointment. To be honest with you, I don't even know if that exists in that simple of a manner, even in a healthcare system with your own private doctor. But that is where we're going. We're looking at streamlining the process, ideally having one website. I'll be honest with you, the CDC does have this capability, but they have, I think, delayed it because they're waiting until more of the general population has access to the vaccine. But we want this to be as simple as possible for everyone. And I recognize the frustration that people may have when it comes to getting vaccinated. But again, the one best place to go is michigan.gov/COVID vaccine. You can get access to our dashboard. You can see how we're doing. Frequently asked questions about the vaccine and the safety and efficacy of them, and also how to sign up for a vaccine if you are currently eligible.
That's perfect. I've learned a lot. I hope the folks on the line have. Tammy, I know we have a few minutes, so I'll turn back to you. But Dr. Khaldun, thank you so much again for your time and everything that you do.
Of course, thank you. Stay well.
Thanks, Matt. Dr. Khaldun, I also know I went online. My aunt lives in Florida, and she has not been able to get a vaccine. She's 86. And I saw the planyourvaccine.com, and that was really helpful for me because I don't know how to follow anything in Florida. So that's a really useful website too. Are you a part of all of that? Are all the states involved in putting that together?
You know, I'm not familiar with that website, to be honest with you, but I do know there are a lot of entities who are working to make it easier for people to get access to a vaccine.
Yeah, you just go online and then you go to the state, you go to the county, and it gives you all the options. But there's still that, how do I get her there? And I'm still trying to deal with from afar. I had a question that was asked of me last week in a media interview, so I wanted to let you answer it. I know how I answered it, but that it appears that the discussion of testing is going away because there's so much focus on vaccine. And are we going to see less information and opportunities to tell people we still need to be tested?
You know, that's a really important point, actually. We still need everyone to get tested. Get tested, certainly if you have symptoms, if you've been exposed, if you've recently traveled, please do get tested. We actually are expanding our testing significantly. We're working with schools and others to be able to expand our testing. So testing is still very, very important. That's how we're going to understand where the virus is so that we can slow its spread.
So once we get vaccinated, all of us, or a majority of us, we're still going to need to wear our mask and wash our hands. And how long do you think, once the general population is actually vaccinated, how long will we still have to go wearing masks and taking all these safety precautions?
You know, some of that has to do with data that we don't quite have yet. So the reason why even after you get a vaccine, you still have to wear your mask is because the studies did not evaluate whether or not you could still pass the virus to someone else, even though you may not have symptoms. So that's why everyone still has to wear their mask, even when they're vaccinated. We also don't fully understand at this point how long these vaccines will last. We don't know if you'll have to get a booster shot, a new one, like we do the flu shot every year. So again, as we get more and more data and more studies come out about these vaccines, we'll learn more. But what we know right now, they are 95% effective, and they're safe, and they're saving lives. So that's really, really important. Please do get your vaccine when one becomes available to you, and we're doing our best to bring more vaccines into the state.
Well, obviously the Chamber is trying to support you in that effort. The Detroit Regional Chamber keeps a lot of information out there for our members around COVID-19, but we also continue to educate and get awareness out about the importance of the vaccine, and we'll continue that for you.
Thank you. Thank you for your partnership. We appreciate it.
You're welcome. So we have just a few minutes left. I'd leave it open for you to discuss anything I didn't ask, Matt didn't ask, but you think is important for our listeners to hear. You
know, I'll just say, you know, we're seeing the light at the end of the tunnel, but we're still in the tunnel. I know it's been an incredibly challenging year. We've been at this for almost 12 months now, since we identified our first case of COVID-19 in the state. We've seen, you know, a terrible number of cases and deaths, and people who are still struggling with recovering from the virus. And so it's really, really important that people just maintain their vigilance, and please wear your mask properly every time you're going to be around someone outside of your household. As I said earlier, if you are having symptoms or if you've been exposed to someone who has symptoms, please do get a test. We still have many community centers with tests across the entire state. They're often available to you with no out-of-pocket costs, so that's very, very important. We will get there. And getting a vaccine is the way we're going to end this pandemic, but please be patient as we work to get more vaccines into the state.
Well, Dr. Joneigh Khaldun, we are so happy to have you here in our state, taking care of us. Please keep up the good work and know that we all are there behind you, and we'll do whatever we can to help going forward.
Thank you so much. Stay well.
You too. Thank you, everyone, for participating, and our teletown hall will now be ending. Thank you.